about the Baptist Orthopedic Hospital. We have a Baptist Orthopedic Hospital at North Central and Mission Trail Baptist Hospital. It is South Texas' only ortho hospital dedicated solely to orthopedic care. It is for patients of all ages seeking diagnosis and treatment of diseases and injuries ranging from arthritis to sports-related, hip and joint replacement, spine operations, and others. Our dedicated physicians, nurses, therapists, caregivers, and other healthcare providers are hand-selected by the Baptist Health System for their expertise. One of those fine doctors is joining me today, Dr. Robbins. Thank you for joining us, and we look forward to your presentation. I'm going to hand it over now to Dr. Robbins so he can walk through it with us.
Great. Thanks for having me, and thanks to the Baptist Health System for hosting this. I'm going to go ahead and share my screen here. Okay. All right, there we go. So I'm going to be talking about conquering foot and ankle pain, minor setback, epic comeback. All right. So this is me. I'm a orthopedic surgeon who's fellowship trained in ankle and foot surgery. I want to talk about some common ankle conditions that I treat or that you may experience. Some of the more common things include ankle instability, or the sensation that your ankle gives way or you continue to sprain your ankle. Arthritis in the ankle or hind foot, which is typically associated with pain or swelling or mechanical type symptoms like locking, clicking, or popping. Achilles pain, that's that large tendon that we all have in the back of our ankle, which can become inflamed or in certain cases torn. Cartilage injuries, which can occur when playing sports or exercising or cutting or pivoting. Fractures and broken bones, and then tendonitis, which is typically an overuse injury to one of the several tendons that cross your foot or ankle. So some of the common things that you'll see with any of those diagnoses include pain. It can be sudden, it can be severe, it can be constant, it could be intermittent. It's just pain. Swelling, bruising, typically you'll see that when there's some sort of acute injury. Obviously, if you have an inability to walk or bear weight, that's concerning, and that's something that should be evaluated sooner rather than later. Like I talked about, some of these chronic conditions can present with sporadic type pain or weakness or the sensation of instability. These are all things that typically should be evaluated by an orthopedic surgeon who takes care of foot and ankle problems. So although I am a surgeon, there are plenty of other things that we can do to help you with your pain. It may be something as simple as stretching and strengthening. It could involve therapy with a therapist where you work on motion and strength, and the therapists typically have other modalities or machines that they can use to help treat your pain. It could be using a medicine such as an anti-inflammatory, or an injection where we inject some numbing medicine and some pain medicine in or around the structure that's bothering you. And then obviously there's surgery that I can do for any of those issues that I just mentioned previously. There are things that you can do to help reduce your chances of having an ankle injury. Obviously, you want to exercise. That's good for any number of reasons, but specifically with your foot and ankle, continuing with low impact exercise will certainly prevent you from having some of these common overuse problems. Whenever you exercise, you want to make sure and warm up and stretch, and then you don't want to exercise or play sports if you're hurting. There's no reason to push through any of that pain. In general, you want to maintain a healthy weight, which is good for the joints of your lower extremity. And specifically for your foot or ankle, you want to wear shoes that fit well and that aren't worn down on one side or the other. So that's just a brief overview of kind of some common ankle injuries and some things that you can do. And now I'd like to kind of open it up to questions for you all in terms of orthopedic surgery for the foot and ankle.
So Kathy, are there any questions that you've received from participants? I have a few more questions, Dr. Robbins, for you from the audience. How would I warm up my ankle before I play a sport?
Great question. So you could start by moving your ankle or doing some range of motion exercises. One thing I'll tell patients is to try and literally spell out the alphabet on the floor. That allows them to start moving their ankle in multiple directions. And then stretching. So in a seated position, you can take your knee and you can place your knee over or in front of your ankle, and that starts to stretch out the posterior back portion of your ankle or your Achilles tendon. And so those maneuvers, just literally moving your ankle in multiple directions and stretching out that Achilles tendon, are a great way to warm up prior to doing any sort of sporting activity or high impact activity.
Okay. There's a few more questions. Is there an exercise or orthotic to minimize pronation? I'm going to ask you, what is pronation first so that we all understand it?
Sure. Pronation is commonly flattening of your foot with subsequent development of a bunion, but really it looks like your foot is a little bit flatter. There's no one orthotic that can necessarily make it better. Certainly people will provide prescriptions for a custom orthotic. What I tell people, I don't really get too concerned about people who pronate or overpronate. I'm more concerned with them wearing a comfortable shoe and something that just feels good on their foot. But there's no one specific orthotic that can necessarily make that better. Some patients will want a custom orthotic or something made for their foot specifically, and that's fine. I'm more than happy to provide that prescription. But really what I tell folks is it's a comfortable shoe. And so just because your foot is flatter or you pronate, for some people that's normal. And there's a little bit of a misconception that is pathologic or bad or can cause problems. But there's a whole wide range of foot position when you walk or run. And as long as you're in a comfortable shoe, those things usually aren't problematic.
Okay. Let me ask you another one. How long does it usually take to go back to my activity after surgery?
Yeah, it really depends on what type of surgery you have. With some soft tissue surgeries where we repair tendons or ligaments, I may keep you off of it for 4 to 6 weeks. If it's a fracture, you may be off of it for 6 to 12 weeks. It really depends on what type of surgery you have for what particular problem.
Okay. Does wearing braces help prevent sprains? And how can I control inflammation before I see you?
So a brace does prevent your ankle from rolling or turning in. And when I see someone who continues to have multiple ankle sprains, that's one of the things I ask is whether or not they've tried a brace, and then I ask to see if they've used the right type of brace. And really it's a brace that provides some rigidity on either side of their ankle. So not a compression sleeve, but something with some rigidity that prevents their ankle from turning in. And in people who sprain their ankle, in addition to bracing, therapy will often help them learn where their ankle is in space so they won't sprain it. But an ankle brace can certainly help prevent you from continuing to sprain your ankle. I think the second part of your question was how to prevent inflammation.
Correct. How can I control inflammation before I see you?
Yeah, so it's some of those basic things that you may, or the participants may be
Ice? Is
familiar
it
with.
ice?
Right. Yeah.
Okay.
Rest, ice, compression, and elevation. So those are kind of the at-home remedies that you can do to help with that.
Okay. Let's see. Does a foot and ankle surgeon treat plantar fasciitis, or is that for a podiatrist?
That's a good question. I see plenty of patients with plantar fasciitis. Both podiatrists and orthopedic surgeons treat it, and everyone has a different approach to it. Typically, when I see someone with plantar fasciitis, I'll recommend a topical medicine, supervised physical therapy, a gel heel cup to pad that area that's inflamed, and sometimes a splint to wear at night to prevent their plantar fascia from contracting. Within our subspecialty, very rarely do people get surgery for that because it responds well to the right type of non-surgical treatment.
Let's see. Is wearing a running shoe healthier for your ankle or feet rather than running in a barefoot running shoe?
Yeah, there's a lot that's come out, over the last couple of years about the effects of barefoot running. And again, I'll go back to what I said before. For some people who like barefoot or minimalist shoes and feel comfortable running in it, I don't discount that or say that's bad. It's just it's not for everyone. I tend to recommend a shoe with a rigid sole when you're running. but there are some runners that swear by the barefoot or minimalist shoes, and you know, if that's what they want to run in, that's fine. In terms of is one better than the other, there's not a lot of definitive evidence one way or another. I just tend to prefer a more rigid sole when I have patients run.
Let me ask you, is robotic surgery an option for foot or ankle surgery?
So in terms of robotic surgery, there's more of an application for that in some of the larger joints, specifically the knee. For what we do in foot and ankle, we don't typically use a robot. We do use some custom cutting guides when we're doing certain surgeries that are made to fit the patient. But right now, we're not doing robotic surgery in the foot or ankle. There's not really much of an application for that in foot and ankle surgery right now.
What is expected recovery time for, I guess there's a variety of surgeries, but if you can give us an idea between foot and ankle, kind of
Sure.
the recovery time for that.
Sure. So if you have let's just take an ankle fracture. If it's an ankle fracture that requires surgery, typically you're in a splint for a couple of weeks to allow your skin to heal. And then depending on the severity of your fracture, you may get transitioned to a walking boot at 2 weeks. You may require a cast for 2 to 6 weeks. The idea is once your fracture is healed and stable to get you walking again. In terms of something like an Achilles tendon that's torn and that I repair, we'll put you in a splint for 2 weeks, and then at 2 weeks, I want you to start walking on it in a walking boot. For some of my ligament surgeries for patients who sprain their ankle, I'll repair their ligaments and place them in a splint to keep them off of it and allow their skin to heal. And then somewhere between 2 to 6 weeks after that, we're putting you into a walking boot and getting you into physical therapy.
Can I ask you what kinds of complications can occur?
Sure. Similar to the complications in kind of any other musculoskeletal surgery. So there's always a risk for infection. That's minimized because we give patients antibiotics and we use sterile technique. The bleeding risk is pretty minimal in the foot and ankle because the big blood vessels that cross the foot and ankle are typically not in the field where we're operating. In terms of a scar, you know, you're going to have a scar whenever we do surgery, and we try and minimize that. Patients may have some numbness around those scars. That can be temporary, that can be permanent. Blood clots or deep vein thrombosis is a concern whenever I do surgery, and so I typically place patients on an aspirin to prevent that risk. Those are the big risks associated with ankle and foot surgery.
Okay. Have a few more questions from the participants. Can high heels cause bunion deformities?
So a narrow toe box shoe, or a shoe that's narrower, tighter than your forefoot, causes your toes to get crammed in there, and it can lead to a progressive bunion in your foot. Now, I'm not saying you shouldn't wear them. I mean, certainly if that's what you want to do, that's fine, but it doesn't help. It certainly can lead to a progression of a bunion.
Is it just because this is my question, is it just, it molds the foot a certain way and it's
Your forefoot that's the widest part of your foot, and you're putting it into the narrowest, into a narrow shoe. So it's a molding phenomenon.
Okay. Here's another question. What are some preventative measures I can take as a runner/athlete?
Right. So, we talked about some of this in the presentation. Certainly stretching before you run, and then also stretching after you run or do sports is important. And then making sure that you are not trying to play or exercise through pain. I mean, if you start to notice that something's hurting, then that's the time to stop. All right. And instead of trying to go back the next day when it's hurting, do a different exercise or do a different activity. But it's a matter of making sure you're stretching and then making sure that you're not trying to push through any sort of pain. Okay.
Here's a great question, because this is something I would want to know. Do you have any tips for strengthening your arch in your foot? You know, ironically, just myself personally, I tend to wear supportive shoes or flat shoes, not a lot of high heels, just a normal heel. But I've just noticed, and I don't know if it's age or what it is, but every once in a while my arch will feel like it's hurting, or like anything can pop in a certain moment. And so that's a great question. Is there anything you can do to strengthen your arch in your foot? Or when you're feeling those things, what can you do?
Yeah. So there's a large tendon called your posterior tibial tendon that crosses the inside of your ankle and is responsible for maintaining the arch of your foot.
Mm-hmm.
And there's not much you can do to recreate an arch in your foot on your own. And as we age, you tend to get some flattening of your foot. So again, it's not necessarily, some people will say, well, I need this insert or that insert. And I try and steer people away from that and just recommend comfortable shoes. A real rigid insert or something that's stiff that builds an arch for you, most people don't tolerate. So it's really about just wearing something comfortable. And that tendon, it's the tendon that pulls your foot down and in. And so just stretching that and then doing low impact exercise is good really for all the tendons that cross your ankle. But in short, there's nothing you can do to increase your arch or keep it high arch, a high arch. All of us are going to get some progressive flattening over time.
It just happens. So curious, you were talking about the, anything hard, some people can't tolerate, but I notice a lot of the running shoes or tennis shoes or what have you, they have that memory foam. Is too soft kind of bad for your foot?
No, I mean, something that's comfortable for your foot and it provides some rigidity when you're walking. Something too stiff.
Kind of the stability on the bottom or whatever.
Correct. Yeah. As opposed to on the bottom, you want some stability, meaning what touches the road or ground should be rigid. What's touching your foot should have some padding.
Okay. Thank you for that.
Yeah.
Let's see, I have a few more questions, and it looks like we have, the participants have a few more questions too. Maybe you answered this already. How soon will I be able to walk after surgery? You kind of did, because you talked about the boot. It just depends on the type of surgery. So I apologize. You already answered that question. Let me take a question from one of our participants. If you don't mind, actually it's a comment, and it's endorsing a wonderful shoe. She loves her New Balance shoes, and actually you too. I have a couple pairs of those, and those are some of my favorites. They last a long time. They're supportive. They're great. Anyway, now we had a PSA for our New Balance shoes. Let's see. When you have some of the surgeries, the foot and ankle surgeries, do you use any kind of implants?
Yeah, I do.
I guess what materials are those implants?
So when we're doing fracture work, it's typically steel or titanium. And then obviously we use sutures to repair tendons and ligaments. Some of the sutures are attached to different types of bone anchors that are made out of plastic or bioabsorbable materials. So yeah, there are implants that go in.
Let me see. I think you answered this too, but I'm going to ask it. What can I do to help keep my joint replacement functioning as long as possible?
So I think what specifically in the foot and ankle, it's an ankle replacement.
Okay.
And so, ankle replacements are made to provide painless range of motion in your ankle. It is not made for high impact activity. And so once you have your ankle replaced, certainly you can do low impact activity, things like golf, hiking, doubles tennis, and maybe even some light jogging, skiing, downhill is fine. Things like moguls, football, 5-on-5 basketball, those things become increasingly harder once you have an ankle joint replacement. And so you really need to kind of transition to lower impact activities. When you're at the point where you get an ankle replacement, you're typically in your 50s or 60s, and usually you're starting to move away from some of those high impact activities anyway.
Sometimes, right?
Right.
Let's see, I have another question. How do you know if you're a surgical candidate? Let's see, do ankle replacements deteriorate over time?
They do. They're like hip or knee or shoulder replacements. They're made out of metal and they have a bearing surface and that we say is plastic. And just like any part in your car, with time, it'll deteriorate.
And how will you know? Will you have pain again or?
Correct. You'll have pain. You'll start to have a decrease in your ability to walk. You may have some increase in popping or clicking, but the big one is pain and a decrease in function from where you were after you had your initial replacement.
Okay. I have another question from a participant. After Achilles tendon repair, do you send patients to PT, physical therapy?
I do. That is the hallmark of recovery after Achilles tendon repair. The whole reason we do it is to get you into therapy or rehab as soon as possible. Whereas historically we used to repair them and place you in a cast for 6 or 8 weeks. Now I repair your Achilles tendon, and then once your skin's healed, I want you in therapy to get that accelerated rehab.
Okay. I have a question for you. I know for knee, I don't know if this is the same for foot and ankle, but sometimes people do injections to help a little bit with the pain. I don't know if that just prolongs eventually, surgery they may need. Does foot and ankle operate the same in that you can get an injection to help alleviate the pain?
Definitely, yes.
Okay.
Whereas in larger joints, the knee or the shoulder, it's pretty easy to do that in the office. Some foot and ankle injections require some advanced imaging because these are small joints and small structures. But yes, injections, and like I kind of alluded to in the talk, I use those pretty liberally in my practice to kind of help with pain, because for some folks, that's all they need is something to just decrease the inflammation. In some cases, it helps with the diagnosis. So I use that injection to help me kind of confirm the diagnosis. But yes, we do use injections in foot and ankle surgery.
So meaning like to confirm the diagnosis, like if the swelling goes down, you're better able to see what's happening in your—
Right. If I inject a joint and you get relief from that joint injection, well, then that's the joint that's bothering you. There's so many in the foot that sometimes it's not as easy as someone pointing to it and saying, this is where I hurt. Their pain may be diffuse or all over. And so that's where it helps in cementing the diagnosis.
I know we take our feet and walking and all that just for granted, when we can do it. And then when you can't and it hurts a lot, it's something else. Let's see. I'm going to ask Kathy to see if we have any more questions from the audience. Kathy, do you have any on your end?
Yes, I do. I have one. How can I prevent arthritis of the foot or ankle?
So, there's not a lot that you can actively do to prevent it. In certain patients, it's going to happen irrespective of what they do. I mean, the low impact activity, things where your foot is always on the ground or a machine, bike or elliptical, walking, those things certainly prevent or may help prevent the progression. But there's not a lot you can actively do. Unfortunately, if you injure your ankle or you have a fracture within your ankle or that affects the cartilage, you may develop arthritis no matter what you do. So if you absolutely love doing high impact type things, then please, by all means, continue because that's what you want to do and that's what we want you to do. If you develop arthritis, then we help you by treating the symptoms. We treat the inflammation, we help with the pain. And when those things that we do that are non-surgical stop working, that's where there's a role for surgery. But there's not a whole lot that you can do to actively prevent arthritis other than preventing yourself from getting hurt in the first place.
Yeah. I want to remind everybody in the audience that please participate. If you have any more questions, we have a chat box and just put your questions in there and we will get to them. Kathy, have I missed any questions?
We have another question that came in the chat. I'm experiencing popping, but no pain every time I rotate my ankle. Is that normal? Or could that be a sign of a future ankle problem?
Yeah, so a lot of people will comment on their popping, and I worry about popping if it's painful and new. Joints pop and click. There's fluid with them. That shifts around, and you'll hear pops and clicks. And for me, I do not get concerned about it unless it's new, it's increasing, and it's painful. But painless popping, I can crack my knuckles right now. Not that I want to do that on the chat, but I don't really worry about it.
Okay. Kathy, any other ones? I don't see any on my end.
No, there aren't any other questions at this time.
Okay. Let me ask you, Dr. Robbins, I know you do some of your surgery at our Baptist Orthopedic Hospital at North Central. I talked a little bit about that at the beginning, and I'm just curious that, why do you find the orthopedic hospital so helpful in what you do?
Yeah, it's great. That's a great question. That's a staff that takes care of orthopedic patients, and what we do is it's very specialized. It's very specific, and so having pre-op nurses that know what we like and what we expect, having scrub techs and circulating nurses that know what we do and do it over and over again, and having nurses on the floor who take care of our patients immediately afterwards. Really, it makes the whole experience that much better. And really, repetition, improves outcomes and decreases error. And that's why it's great practicing and working in an orthopedic hospital, because everyone knows what you're doing. Everyone's seen it before. They're going to help you get it taken care of and done right. And I really enjoy working there.
So it sounds like a cohesive team, and that's what they do all day, every day.
Yeah.
That's awesome. And I know that there's dedicated rooms and there's dedicated ORs. So, that's amazing. Great.
Yeah, it's very efficient, and they do a great job. The whole staff there from top to bottom.
Wonderful. Let's see. If anybody else has any more questions, please submit them in the chat box. We'd love to hear from you. I want to thank everybody for being part of this. We're not over yet, so if you'd like to add some more questions, please do. I'm curious, Dr. Robbins, have you ever had to have a foot or ankle surgery?
No, I have not. I had a knee surgery, which led me to orthopedics, but I have not had any foot or ankle surgery yet.
What kind of injury? I didn't hear. I'm sorry.
I had a knee injury.
Okay.
When I was in medical school.
Oh, okay.
Yeah,
and that knee operation.
That sealed it for me, and I decided I was going to do orthopedics after that.
There you go. Well, that's wonderful. Let's see. I have another question here. What can be done for bottom foot burn after ankle surgery? The surgery was for repair of ruptured anterior tendon.
Yeah, I mean, that can be any number of things. I think in the end, whoever did the surgery, needs to evaluate you and determine whether or not it's a problem with your shoe wear versus something else going on with your surgery. There can be any number of things.
If this was something that occurred for this participant maybe a couple years later after the surgery, could any doctor evaluate her? Could she go to anyone else, not the same surgeon?
Yeah, I think so. I mean, usually surgeons want to see their patients, and if they're having issues, they want to address it. But
Sure.
I think she can be seen by another surgeon. I think that'd be fine.
Okay, all right. If anybody else has any questions, please feel free to ask them. I think we've covered a lot of good information here this evening. We appreciate your time, Dr. Robbins. Is there anything else that you might want to add or say?
Well, I've enjoyed talking. I think these are great questions.
I'm going to ask you a little bit about nutrition. I mean, are there certain things, I know, calcium is good for your bones, just anything else to eat that would be, fortify your bones, I guess.
Yeah, there's no one magic food. I would tell you that a multivitamin is important. And then starting, taking a supplement that has vitamin D and calcium becomes very important for your bone health. But there's no one magic food that's going to make all your bones better. But a healthy diet in general is going to be better than fast food and those other types of things.
You mean all that ice cream I eat at night doesn't count?
No, it doesn't.
Just a little bit. Well, let me check in with Kathy. Kathy, do you see any more questions on your end? I don't see any on my chat.
No, I do not see any questions at this time.
Okay. Well, I want to thank everybody for joining this evening. We appreciate you spending your time with us. Dr. Robbins, we appreciate you spending time with us as well, and thank you for your expertise and answering all these questions this evening. So we hope to have you again. And
yeah, thank you for having me.
Conversation. Yeah. Well, everybody have a good evening. Thank you again. And, keep an eye out for, we're doing several series for orthopedics. So in another 2 weeks, we'll have another one. If you visit our Facebook, Baptist Health System SA, you'll find the next event coming up. So thank you so much and have a good evening, everybody. Thank you, Dr. Robbins.